Good morning, everybody. We're going to be starting in just a minute. Welcome to our webinar, the first of the reINVENT and Rebuild webinar series. If this is where you think you're meant to be, that's fantastic. You're in the right place. So very welcome. As I said, we'll be starting in just a minute. There's a lot of people still joining as I speak. My name is Amanda Harding. I'm going to be moderating the webinar today. Just a reminder to everybody, if you could just keep yourselves on mute throughout the webinar. We will be recording it. We are going to be opening the Q&A to be able to take questions throughout the webinar as well. I think that's pretty much what you really need to really know as we begin. So here we are. As I said, my name is Amanda Harding. I lead Convene, and it's really my honor to be moderating today this reINVENT Rebuild webinar, Build Forward Stronger, Opportunities for Exercise, Fitness and Health. To set the scene for today's webinar, I'd like to welcome Fiona Bull, Unit Head of Physical Activity for the World Health Organization, and absolutely the driver of this webinar series. Fiona, welcome, and over to you.
Thank you very much, Amanda, and a very good morning, good afternoon, and good evening to everyone joining this morning's webinar. Welcome to you all to this first webinar in a series of 8 webinars, which we're calling the reINVENT series. And I'd like to extend a very warm welcome to WHO colleagues from regional offices, country offices, ministries of health, sport, and other governments, departments, and to all the professionals who work in health, sport, and fitness and exercise. Joining us today, you're all very welcome. The origins of this reINVENT series evolved from the 2021 International Day of Sport for Development and Peace, a day which celebrated sport and physical activity, being active, fitness and exercise, and recognized all the benefits that come from this, health, but also the other benefits such as enjoyment, friendships, confidence, employment, and social and economic benefits for society. But this year, it was also a year to reflect on COVID and the impact of COVID on the sport and physical activity system. WHO convened a webinar on April 6th, and through panelists, we heard how the system was adapting and how changes already underway were accelerating. But we also heard about the challenges impacting on the system and facing industry operators, civil society, and all those who provide opportunities for fitness, sport, exercise. So as we look forward into the recovery from COVID, and albeit from different vantage points around the world, we must also include learning from COVID and use this as an opportunity to build forward better. And so the purpose of this webinar series and today's webinar is to continue the conversation started on April 6th, continue the learning and the reflection, but also to identify the practical actions that we can collectively, together, build forward better, a stronger and fairer system. And in today's webinar, we're delighted to have panelists that will enable us to discuss and focus on the fitness and exercise sector in particular, look at the industry's vision, look at how the industry and the health sector interact, look at the workforce and how it can be strengthened for the future and the opportunities within this sector. And running through all of this is how we reach and enable more people to be more active, and we reach all people. So this is both a process and a product. Through the webinars, we hope to build understanding within and across the system on what change is needed, to learn more about each other in this field we work. But it's also a product, and the webinars are being recorded, and WHO and UN agencies will listen, and we're going to use the recommendations and discussions to inform how we can support going forward and the promotion of physical activity in all its forms. We'll produce a report, and this will help the reinvention through being informed by these discussions. So it's time to get started. And to remind you all that WHO and us collectively set an agenda to increase physical activity. We have a global action plan for physical activity 2018-2030 with a goal that we can reach more people and increase participation, health and well-being, 15% improvement by 2030. So I'd like to welcome you again, thank the panelists for joining us, and invite us to watch the video, Let's Be Active. And afterwards, I hand back to Amanda Harding, our moderator for today and the series. Let's have a look at that video. Thank you very much.
We live in a world beating with urgency, breathing with difficulty, breaking under necessity. We are a society consumed by technology, compact in proximity, choked by inactivity. We are global, we are responsible, we are trending, we are too inactive. Everyone, everywhere, every day. We have a plan. It's time to activate our governments, to activate our environments, to activate our society, to activate ourselves. It's time to activate movement, to activate improvement, to reverse our direction, to activate new trends. We need to alert you. We need to activate. Everyone, everywhere, every day.
Fabulous, thank you. And again, thank you, Fiona, for setting the scene. I'm just going to take a couple of minutes to just remind everybody how we're actually going to work this webinar today, what we're going to be doing. Over the next just under 90 minutes with this fantastic group of panelists, we will start by talking, as Fiona said, to their vision to engage more people to be more active. We'll be discussing what needs to be done to strengthen the links between exercise and fitness sectors. And we'll go on to explore how collaboration can really be a lever for change in the system. We're hoping that we will be really authentically forward-looking and proposal-driven. We're really wanting to build and make recommendations. We're wanting to really build forward better, as Fiona has just said. Throughout the webinar, we will like to see your questions. So these can be posted on the Zoom Q&A. Please don't use the chat, do use the Q&A. And time allowing, we will try and weave some of the questions into the conversation, but we've also asked our panelists and the World Health Organization team to respond also in the Q&A, in that function. So we want to pull everybody into this conversation. This is a conversation between everybody. This is not going to be a set of set pieces. It will be informal, but very content driven. I would now like to welcome our panelists who are all passionate, all experienced, come from a diversity of perspectives, but clearly have a common determination to see more people being more active. And we'll hear from all of them. Hugo Brahms is the CEO of Virtua Gym. Andreas Paulsen, the CEO of Europe Active. Anna Schmulzevich, the Associate Professor from Gdansk University. Steve Ward, CEO, Chief Transformation Officer of GoFit. Jürgen Steinacker, practicing medical doctor and president of the Global Sport and Health Summit. And last but not least, Ben Ozokwe, youth representative and general manager of a personal training facility based in the UK. So a great group of panelists. We're going to hear from everybody multiple times. But before diving into our conversation, we also have a short video which Europe Active has put together, again, which is setting the scene, giving us a taste of what the conversation is going to be about.
The Be Active Day campaign is an initiative from the fitness and physical activity sector to celebrate the fun and importance of exercise and to encourage people to lead an active lifestyle.
This collaboration between Europe Active and its partners from across the fitness sector takes place on Thursday, the 23rd of September, in the frame of the European Week of Sport,
With thousands of free events and activities organised across Europe and beyond in different locations,
such as fitness and sport centres,
workplaces,
parks,
and many other places. You can do a 1-hour activity.
or just a few minutes.
It doesn't matter.
Every minute counts to be active.
Thanks a lot for that. So we're going to just jump straight in to the conversation right now. And I'm going to call, first of all, on Steve, because we really want to get into this question of the vision to engage and support more people. As I've already said, we want to keep in the back of our minds, in the front of our minds, that we have a context, a real context of COVID that we're still in, that we're trying to come out of, and actually what that means in terms of practically being able to move forward. So Steve, first of all, you've got this great title as Chief Transformation Officer. So of course, I'm turning to you first to talk about a vision. What is your vision for change in the industry? And you clearly do have one. Over to you.
Thanks, Amanda, and thank you, Fiona, for convening this webinar. It's a real honour to be involved and see the World Health Organization playing such an active role in this agenda. I mean, I've been lucky to work in this sort of intersection between health, fitness, sport, exercise since July 2005. Actually, it was the week after London won the 2012 Olympic rights, and I found my way into this area, and I've never looked back since, really. You know, the concept of raising the value and importance of physical activity to society is a mission that I'm deeply passionate about, and that involves including collaborations with the broadest possible range of stakeholders that we can to achieve that objective, whether it's the public, private, third sector, whether it is government at the national, local, or international level, whether it is the largest companies with an interest in this agenda, or brand new innovative startups bringing fresh ideas to the table. The broader the possible team that we can achieve behind that goal, the better. And over time, I've come to view the fitness agenda as very much part of a broader physical activity agenda, in that if we create a more active society in general, then with the rising tide, all boats shall lift. You know, if we can create a more active society in which we value activity in a greater way. And over time, I've also come to view the activity components as part of a broader agenda of well-being. And it's not possible just to look at that in isolation. So that very much impacts my role within the organization that I'm in GoFit. Our vision is much broader than just physical activity. You know, it's to work with our customers to show them that happiness is trainable as well. And the way we go about that is by focusing not just on activity, but nutrition, mindfulness, and recovery in equal measure. Our approach, and I should say, you know, I spent nearly 15 years talking on behalf of the industry. I'm rather delighted that we have Andreas here today to talk on behalf of the industry, and I can pass the baton. I can tell you a little bit about our perspective on things. Our view very much is that we should be aiming for embracing an offer that can reach 100% of the population in a genuinely evidence-based way that can show impact on individuals and their lives using science and technology that adds up collectively to an impact on society, both at a local level and on a far broader population basis. Our organization, Amanda, we see a critical role for the infrastructure of well-being in our communities, and we look to support our city council partners, Madrid City Council, Lisbon City Council, other places, in creating this well-being infrastructure. But the goal is creating a truly accessible, affordable, high-quality, evidence-based proposition that meets the needs of individuals and adds up to this bigger impact on society.
Steve, thank you so much. And I should have also really mentioned that, yes, you come from having worked within UK Active, but today are, as Chief Transformation Officer in GoFit, you're actually part of a large group of gyms. And it's important just to give that little bit of context. And I love the way that you talked about, passing the baton to Andreas, because that's exactly what we're going to do right now. And really sort of ask Andreas, as somebody who is from Europe Active, really representing the industry as an industry association. So Andreas, you've heard what Steve has got to say, and it's, Steve, very inspirational, but also very concrete in terms of, as a large group, what their vision is. From your perspective, looking across Europe, what is really the need for transformation? What is your vision and the plan to support that vision?
Right. Okay. Thanks so much for putting this together, Amanda and Fiona, and thanks to my co-panelists. It's a great honor to be with such a stellar panel today. So when COVID-19 first happened, Europe Active took the opportunity to initiate cross-stakeholder group consultation. So we basically convened our different stakeholder groups, from educationalists to the big commercial chains in Europe, to our suppliers, digital and tech companies, and so on, to have a close conversation with them, and open and honest and even self-critical debate about how we improve ourselves as a sector, how we use this opportunity for self-improvement, how we make sure that we turn the challenges of COVID-19 into future opportunities. And that has fundamentally been our vision throughout the lockdown and the pandemic. Now that we're going through reopening, we have the focus on where we should be as a sector in the coming years, towards the horizon of 2025, which is the horizon that we work towards. And it very early on, it appeared that the critical areas for us is the areas of health, digital, community, and standards. So basically, the overall goal of our sector is to become that public health solution. That idea is not a new idea. That has been around in our sector for a very long time. A lot of pioneers in our sector, academics working with our sector, have been pointing towards that for many years, that we have a unique opportunity as a sector to get European citizens to be physically active more often. And we have proven as a sector that we can do that. Over the past 10 years, we have increased the number of people being physically active through gym memberships and digital solutions and so on, a lot like no other sector. But what we really like to do in the coming years is to look at inclusion and how we broaden up our focus and make sure that every citizen in Europe feel that they have access and are welcome in our sector, and that we have a proper offering for them. So that's really, the big overall goal of our vision in the coming years is to become that publicly recognized health solution. And the underpinning pillars of our manifesto is digital, community, and standards. So that's implementing and rolling out the right digital and tech solutions, and evidencing the impact of our sector through data. And I'll come back to that, what that concretely means for our sector. It's community. It's about building trust and confidence in our sector. Obviously, again, looking self-critically at ourselves, also in a historical light. Our sector, to many Europeans, appears to be about sport and leisure first and foremost, more than health. And so we need to improve ourselves in the sense that, again, breaking down barriers and making sure that everybody knows that we are not about super fit people. That they're also very, very welcome in our sector. But our sector, the European fitness and physical activity sector, is for everyone. So that's first and foremost the community pillar. And the standards pillar is about improving our skills so that we are actually able to deliver that health, our services as a health solution. So that goes for personal trainers working with seniors, goes for trainers working with physiotherapists and doctors in rehab, and so on. So of course, that transformational process is touching upon a lot of different aspects, and we have implemented different initiatives to underpin that process. First and foremost, stakeholder consultation and partnerships. So we have established advisory boards across stakeholder groups that is constantly discussing how do we get there. For example, our president's councils for suppliers, the big suppliers in our sector, and the big operators, the big chains, fitness club chains in our sector. We ask them all the time for feedback and how we constantly make sure that we roll towards these goals, how we improve in this regard, how we improve our workforce, how we become more inclusive, and so on. And as I mentioned, the horizontal partnership bit, how we make sure that we connect better with academia, with the healthcare sector, and other sectors that are working around us that are relevant stakeholder groups for us. So I've been amazed to see how forward-looking and visionary many actors are in our sector. We've tried to have a Robin Hood-like approach where we ask the big actors of our sector to help the smaller actors of our sector. Obviously, we know that a big part of our ecosystem is existentially challenged. That's no secret, like in many other service sectors because of COVID-19. We are in a very serious situation, but we try to appeal to everyone to look towards the future and look towards the opportunities, and then as best as we can try to support and help the smaller and medium-sized actors by the help of the big guys to actually get there.
Thanks so much, Andreas. And again, I had been pushing you to be as sort of concrete as possible, because you've mixed perfectly that sort of visionary, transformative way of looking at things, which is very challenging, particularly given the current context for the industry, to actually say what's in place and how that could happen, with that particularly important message at the end of the sort of, we heard from Steve, the go-fits of the world who are pushing forward, but also actually being able to accompany and encourage and enable the smaller groups or individuals, family-run gyms, fitness centers, to actually also be able to feel robust enough to actually make those changes. One of the things that you also mentioned in your sort of 4 pillars was the standards question. And that's going to be coming up really, a lot, I think, over the next part, next hour or so in our webinar. But just to kick that off or take it a little bit further, I'd also like to turn to Anna. And Anna, this is really your special area, if you like, or even your sort of your area of passion, from what I've heard from you, in terms of actually looking at the workforce and what the workforce of the future really needs to look like. Maybe you could tell us a little bit about what your vision is of that workforce and why it's so important.
Yes, thank you very much, Amanda, for this question. Yes, and first of all, thank you for the invitation to this webinar. I think this is the right place and the perfect moment to talk about, changing our exercise professional education, and to talk about the vision, how the education should look like. And actually, I will not share my vision, but the vision of our entire team from Europe Active. We have been working on this vision for several years now, and we have developed several standards, educational standards, according to the European qualification concept. And these standards are, for example, for fitness instructors, group fitness instructors, personal trainers, but also for exercise specialists who work with exercise participants with special health needs. And we have exercise specialists who are ready to work with pregnant and postpartum women, with the elderly, with the youth, and also with people with chronic conditions. And I'm very glad that in your recommendation, in the recommendation of World Health Organization, we have a lot about the special populations. And I'm sure that we have the same goals here to address the needs of these populations and to do something to encourage these people to be more active. And the ideal world is that we have a task force which is constituted of a properly educated exercise professional, but also of a doctor, physiotherapist, or psychologist sometimes, and maybe by professionals from other fields. And of course, all these people are able to cooperate to implement the lifelong exercise program. This is really important, not here just to treat the condition very quickly and that's it, but we need some people to continue the lifelong exercise program. And of course, we have some examples in Europe that such cooperation works perfectly. We need just to describe these examples, standardize them, and to promote it worldwide. And using the opportunity to be here, I invite the experts from different fields who would like to describe some educational standards for chronic conditions to contact me or Europe Active. We can start the cooperation using the European Qualification Framework methodology even tomorrow, and it will be something concrete that we have after this webinar. But also the ideal vision of our task force is that we are responding to other, not only health needs, but also, as Andrea said, digitalization. So a good example is the qualification, the online provision of fitness services. We have developed it last year, and it was a response for the lockdown due to the COVID-19 pandemic. And it was a complete breakthrough when exercise professionals and the fitness operators didn't have the chance to provide the services. So we had to transform ourselves and to use online version of the provision. And this qualification can be used not only for the lockdown, but also when the clubs are open again. And
can I just interrupt you on this? Because one of the questions coming through already is, that sounds, I mean, first of all, that ability to adapt sounds really interesting. Does that also mean that this could be used globally, beyond Europe? How far can you really go beyond Europe with the experience that you're talking about? You're working in that sort of space between research and research to application within a university, but also associated with Europe Active. Maybe you could sort of give us a sense of that possibility in there.
Yes, of course. So all these qualifications that we are developing can be used globally. And of course, using the knowledge from scientific research and also from practical experience, we are trying to transform these achievements into learning outcomes. And using the EQF concept, we are trying to describe all necessary knowledge, skills, and competences. And these qualifications can be used globally. And of course, we are working not only on the qualification, but also on some other solutions. And a perfect example is the New Health project. This is the project supported is by Erasmus Plus program. And we have developed again the healthy lifestyle promoter qualification, but also an excellent tool, the lifestyle scan. And this is the homework for the audience after the webinar, to use the lifestyle scan. This is a tool that you can use for free, and you can assess the consumer's healthy living habits. So you can use it as a doctor, as an exercise professional, or as an individual. You can check what is your life, and this can be used by everyone. So these solutions are something that we can add to our provision of fitness services. This is simple, this is educational, so we have some materials to tell people what is good for them, what are the exercise recommended for proper for the exact population, and again, what are the nutrition habits and what are the sleeping patterns, and how to avoid drugs, alcohol, and etc. And first of all, this healthy lifestyle promoter qualification is directed not only to adults, but for the youngsters, and it can be achieved by the 16-year-old people who can spread the information on healthy living, just within their age group. So this is excellent situation.
Thank you very much. And again, this is a great segue into, and we'll come back to you in a moment, because we do want to hear about some of the other work that you've been doing and looking at particular population groups as well. You started immediately talking about youth. We know that you've been looking at other groups as well, but I do want to sort of segue straight into, and you talked about this, the digital, Andreas was talking about the digital as well, and actually to go straight to Hugo, because as a tech-based organization, we actually do want to hear a little bit about what you've been doing, particularly in that sort of COVID space as well, because that's clearly sort of played, I guess, to play to your strengths. But is tech really the solution as well for everybody? So maybe let's hear a little bit about how you've been operating, but also how tech actually provides solutions and how far it can really go.
Yeah. Okay. Yeah. Thanks, Amanda. So we're a provider of fitness tech, and obviously during the lockdowns, we've been helping our customers, primarily health clubs and trainers, to keep the services going outside the four walls of their facility, as they were forced to close. So think about tech to be able to do live streaming classes, library with home workout videos, the ability to do like weekly challenges to keep members engaged, but also in general helping them provide a more holistic health service. So also nutrition, meditation, coaching, etc. And obviously, as you say, during the Corona lockdowns, there's been a large spike in demand for these type of services. But I do want to say that we've been doing this for over 10 years. Currently working with almost 9,000 fitness businesses, and every month we're reaching 3 million people using Virtual Gym to stay active. And so this is not, yes, it's been reinforced by COVID, but it was already a trend that started many years ago. The health and fitness app categories in the consumer space, they have been the most popular and fast rising categories besides gaming. So, and I think also there it's fair to say that it's here to stay. And I personally believe that we are just at the start of so much more tech innovation in our industry. And
jump in there with a couple of questions already coming up from the audience. I mean, one is, how can that actually really reach those who are less active, as opposed to just replacing with in an existing space? Is it just, as some people say, just active going digital to who we've got out there? How can we really scale this, but also widen the net using sort of digital?
One of the big fears, obviously, that I've heard a lot is that all those people that started working out at home using technology, they wouldn't be going back into the physical gyms. I don't believe that. I think people, especially now also with working at home, they love going out, they love meeting people, make use of the facilities. So there's always going to be that market of the physical fitness industry, so to say. However, I think that the big benefit of technology is that it can help democratize the fitness offering. I think we shouldn't underestimate that even in our most highly penetrated countries, it's still maximum around 20% of the people that know to find their way to the gym. So that means that there's still 80% that we're not reaching. And obviously some people are doing other types of sports, but I think there's still a big part to grow, and technology can really help take away barriers. And that's first of all the barriers of not feeling comfortable to go into a gym and not knowing how to do exercise. So while doing exercise at home in your comfortable living room, you can build up that confidence, build up that experience. So at some point you're open to go into the gym. But also cost barriers. Not everybody can afford, let's say, a personal trainer, or maybe even go to a fitness facility. So also their technology can provide a very cost-effective alternative to it.
Thanks, Dr. Hugo. First, I think just really useful to sort of get that sort of counterbalance of how digital can actually enlarge the space rather than necessarily narrow the space. I want to come back to you in a moment to actually hear more about how your sort of digital experience actually really links into the health sector, because it's something that we're already beginning to hear about. How do we actually ensure that the fitness sector and health sector are really talking to each other, and how do we start bridging that gap? But before we do that, I do want to bring Ben in, because I know, Ben, you've got another maybe sort of complementary view from somebody as a personal trainer, but also somebody who's been a youth leader in your life and been involved in a lot of outreach work, in terms of if this digital solution really is a viable, useful solution in terms of widening the net, making and helping more people be more active. And great to have you with us, Ben.
Yeah, thank you for the opportunity and invitation. Amazing and thrilled to be here with all these amazing panelists. But yeah, first of all, like just backing up what Hugo said, I think that technology can be a great solution, and especially within like a global pandemic, the use of it has been heightened. Like for our gym, we've had to use it mostly because it's the only option. Like there's no alternative at the moment. Hopefully, like things looking up, things looking better. But just bring it back to the initial videos, what we looked at before, there was a common theme, and it was people training together. And I feel in terms of like sport and exercise, it brings a lot of relatedness, what's actually like a psychological need as well of people. And, you know, especially with like young people, it gives them a sense of belonging and becoming a part of a group as well. Another, you could probably say like downside of technology, obviously, like you said, there it can be like cost effective, but then also some people don't have the resources to use or have access to a laptop, to a phone, especially from like a lot of children from like underprivileged areas and whatnot. So again, like it's potentially could be like favoring people with the access to that sort of technology and so forth was there. I think just from like my experience as well, like embedding fitness and health as for young people, it can create that culture going forward as well. And I think that's the most important thing, is starting people young, getting them confident in sport, getting them confident in going to the gym. And I feel like it just helps them take more charge of their own health and well-being later on in life. I think just researching like over like the past week, there's been loads of interventions within like schools, colleges and so forth, and they found success in improving health and fitness of like young people and the mental well-being as well. And I think just the fact that there's been intervention shows that there's not enough out there, there's not enough incentives out there, and that we need change. For me, I think one thing I strongly believe in is giving like equal opportunity to our children. So our children have the opportunity to take part in like different types of sports and sort of breaking stereotypes. So say if you're from like a specific area, you could be, you know, you're going to be a runner or a footballer, but why couldn't that child or young person be a go-kart racer, like a Formula 1 driver or a horse rider? So it's just giving kids and children equal opportunities and having the accessibility to try different sports, for one, so they can find a passion. And I think the education system and within like schooling and so forth can have like a massive impact and a massive influence in this. And I think it would be like, it'd be harsh enough to expect PE teachers and physical education teachers to be well skilled in all sports. So it's just giving them the support there. So, okay, right, you're not an expert on boxing, but then if a child comes to you and approaches you, right, I want to start like a new sport, giving them the resources so they can outsource, they can go to a boxing gym as well. And again, coming back to like the equal opportunity point what I made before, just making sure kids and children have the equal opportunities there. And I think affordability is like a massive one as well. Like me working with youth, it can be things just such as like clothing, having the right clothing just to take part in the sport, having the right shoes. Like you'd be surprised by like how many children out there don't. And I think the more we can do to help that, then the better. Other things as well is just travel.
And just to interrupt just a moment,
Yeah.
first of all, so that you could take a breath, but also just to be clear that you've talked about a lot of different incentives in a way to try and get people moving into being more active, taking part in more physical activity. And it's just also you know, being really clear what it is that's going to really motivate, what are the incentives that we need, whether they are kids. So you've been talking about kids and young people, but it might be also elderly people. It might be talking about pregnant women, trying to get the incentives right. And we've heard that part of that is actually, you know, there's some digital solutions out there. Are there other important incentives that you think we should be talking about, just very briefly, because then I need to move on to our other panelists?
Yeah, sorry if it was a bit long-winded then. But I think like the main thing for me is breaking stereotypes. I think a lot of people come to our gym and they think, right, well, the gym, I've never been to the gym before. The gym's not for me because this is a certain persona. And I feel like the media and what we put out there can do like a much better job of showing that health and fitness is for everybody. To go to the gym and weight lift, you don't have to have massive biceps and have a six-pack. You can just be a normal person who wants to better their health. And again, like starting people young. So, you know, showing children that you can weight lift and giving them the confidence. So later on in life, they can actually go to a gym, they feel confident, they've tried all these different sports, they know what they enjoy, what they like, and they can take charge of their own health and well-being.
Thanks a lot, Ben. That was great. That sort of link into health. I want to make sure that we really give enough attention as well to this, what we've talked about, bridging, making the connections between the exercise and fitness sector and supporting the provision and advice, counseling to patients on physical activity in the health system. And we're really fortunate that we have Jürgen with us to really guide us through what's happening right now and what do we need to actually change the current situation. And I will turn back to Anna in a moment as well, who's actually really making those connections and doing that bridging. But starting with you, Jürgen, I guess rather than actually sort of describe what the situation is, what would be really great to understand is what is not happening right now, and what would be your recommendations to actually making that, strengthening the system so that we're actually getting the connections, getting the advice being given through health providers on physical activity.
Yeah, Amanda, that's a real problem. We are all in the world happy about exercise, but we don't do exercise. We have countries where 80% of people don't do physical exercise. In Germany, it's about 50% to 60%, depending on the measure. People who don't decide exercise is an issue they should perform. We all raised awareness. Yeah, we know that exercise is beneficial, politicians, everyone, but is it really something for me? And some of my patients said, oh, doctor, exercise is surely good for you. But for me, I'm not quite sure. And then you see that it's an individual decision, but it needs also social support, and it needs knowledge, and it needs also that doctors are aware what they create by counseling. Just to say, change your life, it's a very cheap sentence, but it blames only the patient being responsible for something he's not able to achieve by himself alone. So doctors should learn that advice to change lifestyle habits, it's a very difficult device. We have to work with the patient, and we have to refer to specialists. It's quite clear that I'm, as a doctor in sports medicine and internist, I cannot do jogging with my patients. I will not eat the good diet for my patients. I will not take the medication. So we have to work out, and we have to introduce specialists like fitness sector or amateur sector in our consultation process. And that means the doctor has to change his position in this process.
So that's a big challenge, isn't it? To actually, because you're talking about quite an important cultural change within the medical profession to actually bring in those other professionals so that you're working together with the patients that you're seeing, Jürgen, every day.
Yeah, it's very astonishing. Medical students in my university have 80% sport background, and they're very positive and going to medicine because of their sport background. But they are trained to prevent myocardial infarction, sudden deaths, yeah, and all the training is always going for acute medicine. And acute medicine saves life, it's quite clear. But this means in acute medicine, the doctor decides what is the best to do. I cannot tell the patient to put the catheter in the right or the left artery. What is your priority? That is not a good way in acute or in surgery. You cannot say, decide, should I do this or this? But this training leads to a doctor-centric decision tree. And the patient is only can say, yeah, oh, but there's not a real communication. And this means we need that the doctor sector or the medical sector also need to learn to listen to each other, to talk to each other, and also to cooperate. That means both sides. It's not only the doctors who fail, it's also some fitness coaches say, oh, these doctors don't understand this. No, both do have to perform their role, and this role is communication, and in the center is the patient.
Thanks a lot, Jürgen, because you're now starting to point to the way forward, and that's really important. If you're going to talk about task sharing, some of it you're talking about is about sharing, is about training, But it sounds to me what you're also talking about is actually bringing people together so that actually are talking and working very practically together between what today are quite separate sectors with their own cultures. And that's really quite significant. I'm going to ask Steve to actually comment on that, because Steve, you also are talking about making bridges to health, but does that actually happen? You have your experience, whether it's in GoFit or beyond GoFit, you've worked across this sector. Are you seeing that shift happening of starting to actually bring the health professionals and the fitness professionals together? And if not, what more needs to be done to actually strengthen that?
Yeah, I think it's a really interesting point to explore, this idea of the respective cultures on either side of this bridge. I think we've been building this bridge a long time, and it's almost it's close enough to being complete that some really enthusiastic people can make a running jump and get across the gap, but many still fall in the bit in between. And I think that's because at a strategic level now, the medical community and the physical activity world are, we're talking the same thing. We want to create a more healthier society, a society that values well-being, and a more active society. Therefore, at that high level, we share the same goals, and at the high level, we're able to have wonderful conversations. But perhaps when it gets down to the operational level, I'm not sure if the goals or the why is sufficiently aligned as yet, and we need to work on that. There's certainly some people in the fitness world that see the health agenda as this passing wave that they need to catch and ride, especially in the context of COVID. Many of them are hurting, and maybe they see somewhere in the health agenda as some form of subsidy to plug gaps from what they had once before, or maybe it's the health agenda that's going to generate leads of people to cross the line, or someone in the health sector is ready to bulk purchase a load of memberships. And I can tell you there's no one in the health sector that's thinking about doing those things. There's no one in the health sector, anyone in the world with a surplus of resource thinking, how can I help the fitness industry? What our colleagues in the health sector are looking for is the same thing that individuals are looking for. They are looking for impact and outcomes and results improving people's health and well-being. And therefore we have to think within the industry, and certainly within our organization, we're well on this path. How do we demonstrate individualized, personalized outcomes, impact on people's lives through science and technology, that it adds up collectively to a beneficial impact on community and society? And we're able to do that because we make the investment in R&D. We have a wonderful professor who leads on our academic collaborations with universities across Europe. We invest in PhD programs to evidence our impact. The challenge, I believe, for the ecosystem around our industry is how do we support every organization to deliver that at scale? And that's where partners like, Hugo's organization, or the huge different range of suppliers supporting the industry, can hard weave the demonstration of impact into the DNA of our industry. It's not just about accesses and visits and memberships. It's about impact and evidencing our impact on society. And that, I believe, is the closing of the gap that I would love to see.
Steve, thanks a lot for that. And that, again, in terms of some actually quite transformative change, is actually quite significant, as from the fitness industry moving from a membership performance space to a health and well-being performance space, and moving to that is very much, going back to the vision that you talked about at the beginning. That's quite a significant change, and it clearly aligns with the type of manifesto that I think Andreas was earlier talking about as well. In terms of trying to set the right standards for training, for professionalization, for creating more trust, maybe, Anna, you could sort of come back and just explain to us a little bit more what that looks like for you. What are the changes that are really needed to upskill the workforce that we're talking about? Again, we're talking about bridging this gap still that exists. How can we really do that? And I know that some of the work that you've been doing has also been particularly looking at antenatal, postnatal care for women as an example of how you can actually change the approach to physical activity. Maybe you could just talk to that example, because I think it's going to be really interesting for a lot of people who are listening today.
Yes, thank you very much for this question. Of course, I'm going to share my experience from the research project I've been running for 10 years now in pregnant population. And this year edition is called Hit Mama because we use high intensity exercise in pregnant population, which is quite unusual for some people. And I must say that our participants, the pregnant women who take part in the experimental exercise, they really like to exercise. They want to be active, and they are really devoted to our exercise program. So this is an example for me that we need only a little bit to push them to be active. And the solution is maybe in the thoughts that Jürgen shared with us, that we need the support from medical sector, from obstetric care providers in case of pregnant women. So we don't expect too much. We just need the doctors to ask simple question on the first visit. For example, are you active? Do you regularly exercise? And if the answer is no, so the doctor just prescribe the the medicine, exercise as medicine, just to start any exercise, any physical activity. And in an ideal world, it could be great if the doctor refers a woman to a prenatal exercise specialist or to personal trainer or any other exercise specialist. And I can imagine that some doctors have maybe some doubts who is credible exercise professionals. And this is also a solution already developed. We have the European Register of Exercise Professionals. It works for a few years now, and you can check as a doctor what exercise professionals have been registered according to some very, very high quality requirements. And there are some national registers of exercise professionals. Some of them are linked to EREFs, some not. But this is another homework for you to check what national registers you have at your location. And maybe if you don't have any register, just to find at least one personal trainer, instructor, or exercise specialist to cooperate with in taking care of your patients. So it will be ideal to have the common trust. And of course, we need also some education, as Jürgen said, because we have some evidence that doctors who got educational intervention in a study by Malta et al., it was published in 2016, they were 3 times more likely to give proper advice on exercise comparing to the control group. So we can say, yes, the intervention works.
That's really useful just to have that and to sort of put that into that context as well. And clearly this idea of trust building and connection making and putting in place some mechanisms to make that happen, whether it's, in specific countries across Europe or wider field, globally, sounds to be what you're suggesting is the key to part of that. It's, again, this is we've talked a lot about how people, organizations, groups need to be working much more together, breaking those silos. Or I loved Steve's idea of making the great leap across the bridge and not falling in the middle. We don't want anybody to fall down in the middle, please. This is really talks this question about collaboration and partnership, which you've all mentioned is going to actually sort of crosses all of this and is going to be part of the leverage, if you like, the lever transformative change. I'm going to ask Jürgen to go back to you. I know that you've been involved in the Hamburg Declaration, and maybe you could just explain to us a little bit what that is and why you think that is maybe part of one of those key levers for this collaborative work that is still needed in this area.
First, is quite clear that exercise does not belong to one organization. It's a common knowledge, it's a common experience, it's a common ability. And so everyone in the society has this contribution. And we have, therefore, often in medicine, it's also a fight on resources. Yeah, in a hospital, we have economical pressure. I need to have positive numbers every month, And I'm also accounted by the administration for my economic success. And also in the fitness industry, you cannot run a business without getting reward, money. And that's important. You can only do good things when you are paid. But besides that, we should only look on our own business. We should also look on for our responsibilities. And therefore, everyone has a responsibility. The cardiologist, the orthopedic surgeon, the sports scientist in the medical field, we have also a lot of responsibilities. And we know that the responsibility and the sustainability goals, which are now formulated also by United Nations and WHO, will also be very important for the healthcare sector. So the hospital of the future will be a sustainable health provider, not only providing protection from death, but protection for life. It's a life matter, and this is something where we all together have to share. And therefore, we invented the idea, because I always, oh, you don't own this, I own this. And so then we made this Hamburg Declaration of a global alliance for promotion of physical activity. That means not that someone now claims that's mine. No, everyone who signs this declaration, we have now 50 societies and associations now, and getting more and more. Everyone has his own responsibility, but the common responsibility is to communicate, to share ideas, and to make this world a little bit healthier, more active. And therefore, we think we have the deal to improve awareness, but we have a lot of awareness. But we need in some social sectors, let's say we see in Germany 30% of our migrant population or with low education levels, they are totally resistant to the messages we are doing. And so we have to work on this.
So Jürgen, are there some specific objectives to the declaration, to what this global alliance actually said? Because it'd be just good to hear, if you have some clear objectives.
Yeah, improve awareness, improve cooperation between medical doctors in the sectors around, the community sectors. I would say it's much more, not only the health and fitness industry, physiotherapists, and so everyone loves to be alone, to empower the patients. And that is also the center question, how we empower the patient to use the resources, to empower the medical doctors as well, to better education. They need to learn skills which is not doctor-centric, but it's partnership communication, shared decision-making. The patient makes the decision, but not too much decision, only maybe one decision, and not, I change my life. If you quit smoking, you cannot change your total other habits. And then we have to talk about that our hospitals have to be transformed to active, sustainable hospital with responsibility for the outcome. Not only to be the world champion in Germany, world champion in hip transplantation, and we are also champions in cardiac intervention in Europe. That's good, but it's about to prevent that people always go like a revolving door mechanism, went in and out. And I think that's a very good goals. And we see now that a lot of invasive or interventionist medical societies join this declaration. Some have a little bit problems, but it's because you cannot increase by doing more intervention, more medication. You will not increase the health of the population. And that is a failure.
Thanks so much, Jürgen. So we're looking at a movement within a wider moving environment is what I'm hearing from you. Fiona, I know that you would like to jump in with a question yourself. So why don't you just go for it?
Thank you, and thank you to the panelists and to the questions coming in from the audience. I'm seeing one of the questions, which is taking us to, again, the global perspective, which is asking about, whilst there's lots of facilities that do provide this infrastructure for well-being, as it was referred to, in many European countries, and this panel has got a particular and purposefully European focus to it, we want to learn from Europe. We want to learn in the area of training and the standards. We want to learn in terms of how those opportunities can be provided. And one of the questions is saying it's expensive. It's expensive to get the equipment. It's expensive to get training in countries in Africa and elsewhere. What can we learn and share and build from Europe to build that capacity and those opportunities? And Andreas, can I perhaps target the question to you first? Because it's very important that this series, these conversations are about learning and taking that to scale, because we're simply not making enough progress. You know that from data previously presented. So how can we address some practical problems, helping the industry and civil society in elsewhere, particularly with the affordability of establishing opportunities and initiatives? Andreas, thank you.
Yeah, thanks so much, Fiona. I think first and foremost, it's about sharing. It's about sharing best practice, and it's about collaboration, which we've tried to do as the European Trade Association through our advisory boards and different stakeholder representative groups. And more and more we speak about the health spectrum for our sector. So basically, that means that every facility in our sector doesn't have to be a highly skilled medical fitness facility. At the other end of the spectrum, a trainer can take the seniors for a walk in the park, go to the for a walk to the local theater or local museum, something like that. I was part of building up a medical fitness chain in Scandinavia over the past 10 years, and we built a concept called the Senior Club. Actually, that was part of a Europe Active project back in 2015, which was about healthy aging. And it really showed me how, at the other side of the spectrum, that it's very much, so this movement towards health is something we can all take part in. It doesn't have to come with a lot of additional investment. Obviously, we also look towards medical fitness and upskilling and improving our physical facilities. At Europe Active, we are also focused on standards for our facilities that point in that direction, and that of course come with additional investment.
Yeah,
but I would say
Andreas, let me be bold and just interrupt you, because you're doing fabulous things at Europe Active. We all know that. We're seeing and hearing it, but I'm going to challenge you. There is not a Europe Active across Africa. There is not one in Asia. There is no consistent standards around this. What are you doing, or who needs to do things to build this global profession, this global industry, this global sector? So can I ask you to speak more to, what are you actually doing to help in Asia and Africa?
So coming back to sharing and collaboration, we have initiated a global network to help national association leaders across the world. We have a fantastic network of national association leaders in Europe that we've had 17 meetings since the beginning of roundtables since the beginning of COVID-19 in order to empower and help national associations across Europe, from the small one-person associations in more up-and-coming markets in Southeastern Europe to UK Active that Steve used to be the CEO of, the biggest association in Europe. And we're now expanding that across the world to make sure that on a peer equal basis, that associations, up-and-coming associations across the world, have direct access to our experience and our resources. Again, Robin Hood model, trying to help and support the entire industry. It's about sharing and it's about collaboration to make sure that we get out of the crisis as empowered and as strong as possible and moving towards that health. So we really see the national associations as a key element in this regard. It will not happen. Our sector will not improve skills-wise, digital health, and community-wise without national associations. So I would say, if I was to say one thing, that is the key initiative.
Yeah, thank you. And I hear very clearly that the associations are going to be an important lever, important entry point to build and strengthen the national associations. And hopefully those associations links with the civil society and governments and health sector. Back to you, Amanda.
Thanks a lot, both Andreas and Fiona. And Fiona, please do keep on coming back to us with those questions that are coming from the audience, because we really want to make sure that we have enough time to be able to weave those in. So I'll, just, make yourself known, Fiona, and we'll pull you definitely back in again. Just sort of continuing down the same line as well, because it would be useful as well maybe to turn to Hugo on a similar question, in terms of, Hugo, you're working in this digital space, but from what I understand, globally as well, what is the sort of practice or experience that you could talk to, which is about actually moving from something which is more sort of focused in one particular area where we might have some good standards out there, to actually being able to actually bring physical activity, making it more affordable and more accessible to more people? And you talked a little bit to that earlier, but is that happening global north and global south from what you can see, and what more needs to be done in that area?
Yeah, so I think one of the challenges when it comes to physical activity is in actually having people to commit to regular physical activity, right? Our brains, I think, are very much wired to be couch potatoes. So I think we're more inclined to be inactive and not waste energy. And I think many that started exercising, they would also agree that starting physical activity often also is really experienced as pain, right? So it's very difficult, I think. It's not just about getting people sign up at the gym, it's actually building sustainable lifestyle change. And I think there's multiple ways in doing it. It's providing good coaching and support, but the downside is that it's very expensive. And so I think it's a great initiative that's also being undertaken by Europe Active in increasing the level of education of members of staff in the gym, in the gyms, to increase kind of the coaching levels. But I think technology is a perfect solution to really help protocolize and automate these type of things. And I think in that sense, technology, because you can automate it, it can become so much more affordable, but it can also be more smarter than people. If you see that IBM supercomputer Watson was able to outperform doctors in proposing the right cancer treatment already several years ago, why couldn't we do that with coaching people in physical activity? And there's these great behavioral model psychology theories on how to really help people commit to exercise on a weekly basis. But for those that cannot have a coach, why not have technology really again democratize this personal coaching? And I'm a big believer that this can really disrupt our industry. I've always said the product of fitness is broken, because if you really look at who is working out at the gyms, it's a limited set of people that's actually going to the gym for several times per week, and many are just sleeping members. And I think technology can fix this. So I think that's super exciting.
So I think we're in that dilemma place, aren't we, where digital provides such great solutions, and at the same time always is going to have that risk of also actually excluding some people as well. One of the questions that I see that has just come in is a question about actually quite sort of specific in a way. Hugo, you can give a try at answering this, but we'll actually ask a couple of other people to see what they have to say as well. It's saying, we actually need guidelines for women who stay at home in Asia. So again, we're talking to particular parts of the world with particular traditions and cultures, also with particular roles that women are having to play. What does that mean in terms of, for example, what an organization or the sort of the digital world of virtual gym can actually offer? I'm also going to ask Jürgen, I can see that he wants to come in on that, and I'll ask him to sort of follow up on the answer to that.
I'm not aware of any particular guidelines for women in Asia at home. So I'm going to be careful with kind of assuming, but in my assumptions, it's basically the human body is built the same way. So if we can provide a digital service for people to support them in working out at home through video classes or virtual reality or whatever, I think that could be a good fit for this target group as well.
I think that's true, but it's also not true. We learned that every social people have a different approach. Let's say in Germany, we learned that Spanish background people listen to TV. Turkish background, they listen to their mosque. You have very unique ways to communicate. And we learn in Africa, people have their mobile phone because there's often no TV and there's no current. But we need to, and there are clearly differences even in Germany or in Europe between men and women in their sport behavior, in their awareness and their adherence. I would say we have sometimes more problems with men adherent to programs. Let's say prostate cancer patients don't do exercise. Breast cancer patients, which are female, are the best achievers. I know my breast cancer classes are full. Prostata, why exercise? And in Asia, we have the problem of the social cultural segregation of women, which don't want to be opposed. Women have a problem. They don't want to sweat. We have seen in the States the same problem. Yeah. So we have to look at the cultural differences, and we have to see that it's a huge burden of disease in Asia and in Africa. 30% diabetes in Sahel. It's an incredible problem.
Yeah, thank you, Jürgen. Can I come in and just pick up on this conversation about how we communicate? And I want to repeat something that Hugo just said in case people missed it. You said the product is broken. And that's profound. And I also recall, Ben, you mentioned the role of media and tying these ideas together in the question from Asia, whether it's physically what you're doing in terms of the amount, or indeed, in fact, having the opportunities and understanding all of the different ways you can be active. So why is the product broken? Is it how we're positioning it, how we package it, how we communicate it, how it's marketed? And there was comments about this image, the persona. And I wonder whether any of the panelists would like to pick up on that and react. I suspect I can see a number of you are all nodding. So Andreas wants to speak to it. Steve does, and I think Anna does. But let's go to Steve first. And I'm asking for short answers in the interests of the last 15 minutes, please. Short answers. Is the product broken, Andreas?
Andreas or me?
Oh, sorry, Steve.
I'll fight him for the mic. No, listen, is the product broken? I think we have to say most definitely for a certain group of society, the product is not broken. It serves their needs very well. The question is, how do we make the product more relevant to a far broader range of society? And I think I was very excited by something Hugo mentioned, which is around the use of technology to democratize services. And you know, the story of what Watson is doing in cancer care, for example, is very relevant to our industry. And I can give you just one example in our own world on this, in that typically our fitness professionals gravitate towards the people that most resemble them, and the people that most resemble them happen to be the customers that cross our doors, who are motivated, habitual, who are very competent and are very confident in what they're doing. So there is an issue that the people that consume most of our services are either the people that probably need them the least, or in fact are willing to ante up and pay more for even more intense services. And that within our organization is something that runs counter to our ethos. We have no personal trainers. The idea of having people you can only talk to if you're willing to pay an extra 50 euros is just absurd. Our focus is on using technology to direct our staffing resources towards the people that need us most. And we have a program, a pathway within our services of life recovery, which is understanding the physical capabilities, the psychological position, the emotional position of our customers, and identifying those who need us the most and allocating our staff resources to those people in a more intense way than the fitness freakies who are on the right path. You know, they can continue, we'll challenge them, we'll motivate them, we'll push them, but they're okay. And that would be impossible without technology. It would be utterly impossible
and
without
good staff. And I think that loops back to some of the remarks about quality of training standards, so that there is the breadth of competencies to engage more inclusively people who have different backgrounds, different cultures, values about it. Andreas, I'm really going to ask for a short answer. So please, apologies, but the best of your answer, please.
Yeah, to put it in a very short way, I don't think our product is broken as such. Over the past 10 years, we've shown that we can make people more physically active more often, more than I would say any factor in European society. But we need to self-improve by looking self-critically at ourselves and you know, becoming that publicly recognized health solution. We need to change our professional identity and our culture in that way. We need to act like a public health solution rather than traditional fitness in order to appeal to non-traditional fitness users, to break down barriers and to become more inclusive. And in that regard, you know, it's very much about our market messaging, that we don't always show pictures about high fit people on a beach that might even not be in Europe, but in Los Angeles, perhaps. You know, we need to look at the messages that we send into the market. Our product, the core product, appeals to so many people, and it would make their life socially, mentally, and physically better, and they would get more well-being from it if we reach them. The problem is that we oftentimes put up barriers to our own reach by communicating to.
Yeah, thank you. And sorry, apologies to cut you off at the end, but your point about communication, I'm really interested because Ben, you really triggered this with your comment about media. And of course, we very much want to reach the young population. And I'm looking for Ben to see whether he'd have a remark again about how we can better put communicate, message, market, some might say, being active. What is your recommendation for us going forward?
I think to strive away from like perfection. Like when you look at, you know, any like gym advertisements, when you look at even gym sportswear, it's always fit, healthy people. And sort of just to stay away of that. And it's not about that. It's about being a better version of yourself. So, okay, so say if you're still slightly overweight, but you started training, you're walking more, you're out and about, then you're going to live longer. You're going to live a little better life. And I feel like educating people around that, you'll be surprised how many people come to the gym in their adult years and they still don't understand to lose weight, you need a calorie deficit. Or if they increase their step count, they're going to be more active, healthier, they're going to move, they're going to live a better life. And I think it's a sense of urgency, and it can definitely be started young. So in school, giving them the support to educate them there. Like when you get to year 10 in the UK, so like 15, 16 years old, physical education is optional, but really it should be mandatory. So again, it's just making sure people have got the tools there, the education, the resources to take charge of their own health and well-being. And then if they need to outsource, if they need help, making sure that support there for them as well.
Back to you, Amanda.
Thanks, Fiona. I'm just going to add a question to Ben because I'm just seeing some of the questions coming in as well from the audience. One of the questions is, you know, particularly for younger generation who, when they are able to actually get employment today, are working really long hours. You know, not necessarily in the best conditions, but are working really long hours. How can they actually be physically active given what's being asked of them?
Yeah, perfect question. I think as well with that, it's making sure the workforce are aware of that. And I think if we educate the system, if we put this message out there to people, and then employers should be more aware. So right, you're not working 12 hours today, you're working 11 or 10. So you've got that hour to go away and exercise. And I think it should be more of an open discussion. The way I like mental health over the past few years has been more open and people have been talking a lot more about it. After a global pandemic, you would expect fitness and health to be more an open discussion. And I think just the fact that we've had in the UK like a eat out to help out scheme, and there's not been a workout to help out scheme, shows the priorities of the system, and I feel like there needs a lot of changes.
Yeah, that's a really good point that you're making there in terms of where the system and this idea of actually, we started right at the beginning of the conversation talking about a transformation of the system, and we seem to be sort of coming full circle to that. If we're talking about, eat out to help out, why aren't we doing the same thing in terms of physical activity? It's a really, really good point. We are really missing what's really essential in terms of recovery globally right now. Thanks a lot, Ben, for that. I guess, we're coming to the sort of wrap up point of the webinar right now. Fiona, I am going to turn back to you to actually sort of pull this together. I mean, I'm going to wish you good luck to do it, because we've done a sort of a full circle. We started by talking about, what our vision really is, our vision of transformation, and trying to make that as concrete and practical and possible and plausible as we could. We've moved from that into trying to really talk about that gap between physical activity and the professionals in that sector and the health sector. And we talked about bridging and bringing people together. We've talked about collaboration a lot. We talked about a broken product. If it is broken, what do we need to fix it? Or if it's not broken, what can we actually do to strengthen it, which seems to be the direction we're going in. Fiona, over to you to try and then sort of pull that and help us look forward.
Well, thank you. And as you say, not an easy task. Let me extend my thanks to the panelists for a challenging and insightful conversation that we've had. We set out with this webinar wanting to talk about the opportunities that we can draw from the COVID pandemic to build back better and build forward a stronger system. And what we've had opened up in this conversation is both within the sector, the need for horizontal partnerships, and that was helping each other, whether that's described as the larger, more established, helping the startups is one dimension. I extend that to here the opportunities and the need from our audience to extend that horizontal partnership globally to support the development across other countries and regions. There's also a need to bridge between and partnership across sectors, which we all see we're all part of, because as Jürgen said, we don't own, no one owns physical activity, we all contribute to it. But there's a need to complete that bridge. And we heard from Steve this analogy that they're getting closer, but we're not quite there with a firm pathway between, within, and in all directions of health to fitness. But we need, so you did say the great leap. Let's see how over this conversation and going forward, we work out what are the last remaining pieces to make that connection and strengthen all parts of it. Training and capacity and workforce were a clear theme, very promising and excellent lessons to learn from standards that are created in Europe, and we know they're available and developed elsewhere, but very pleasing to hear about the initiatives of standardizing globally, raising the professional standards, because it provides more opportunities. And it also, as others have mentioned, builds understanding and trust of the industry, recognition of the industry, and those working in it, in whether that's as personal, self-employed, or in civil society, or in the private sector. So again, I hope that can be an area we pick up on, but very well heard. The idea that there is also a need to have cultural shift. And Jürgen spoke at length about the importance and changes needed within the health sector. And of course, COVID has highlighted the importance of physical activity for mental and physical health, the importance indeed for building our resilience, and the importance in treatment and management of patients. And yet we heard the need for more training within the health system, within health professionals, and we need to build that sort of capacity and networks and system of task sharing. And that's not a finished conversation. It's not an old conversation. Sorry, it is an old conversation because it has been ongoing, but we really have got to focus again our efforts on that aspect. How it's communicated seems to have been risen by a number of the comments and reactions, and we just spoke a little more about it. And it does seem there's a disconnect, that there's a very powerful, strong image of what being active, being fit, what offerings are available and what you might need to be like to participate. And yet on the other side, there's a very clear call, in fact, shared understanding that we want to offer more and reach more people with what they want to enjoy and do and make it accessible and affordable. And technology has been raised in two ways: real opportunity to democratize, to disrupt, to change, and it's been accelerated, but still that very clear question about for who. And so I'm challenging the audience, challenging the sector, challenging industry, and we will be in our series reaching out to startup communities, digital technology partners. How can we come and build that bridge? How can technology truly deliver new technology and even old technology to encourage and support all people to be active in all different places? We're not focused here exclusively on bricks and mortar of places. We know the community, local facilities, parks are also, and our streets where we walk are important venues. So a wide-ranging conversation covering partnerships, communication, professionalization, and the role of really working together. And that's really the theme going forward, because we have only just started and continued with the expertise shared by this panelist, and going forward into future, the next weekly webinar on Thursdays for the next 6 weeks, we'll continue this. And if I may segue into some final remarks and promotion of what's next week. Well, next week we will, as shown in the slide the audience is seeing, we'll continue this conversation, learning the trends that are being really accelerated via our speakers, who will look at, again, how will we be an inclusive system, very much focused on an inclusive industry, an inclusive workforce, and an inclusive participation. And the topic of communications, in fact, will also be addressed by one of our speakers, how we can perhaps change how we message about physical activity and speak more and more effectively to the people we're trying to reach. After next week, to whet your appetite for future, week 3 will be about the research evidence on the protective effect of physical activity and severe COVID outcomes. Tune in for week 3 to listen to some of the leading scientists talk about that evidence. The digital and innovation agenda is in week 5. So come again to hear some startups, tech folk, as well as physical activity, sport, peace and development community, talking about how we can use technology to accelerate but not further divide opportunities. There is a whole series. I won't go through all of them, but I know in the chat box we're giving you a link to where you can get more information at the WHO website and download the full program and QR codes for registering. So as I hand back to the moderator to do final closing, thank you to the panel. Thank you to the hundreds who have joined this conversation today. Thank you for your questions. Join us next week, and back to you, Amanda.
Thank you so much, Fiona. And I guess it's left for me again just to repeat those thanks to really a fabulous group of panelists. I hope that you managed to get your key points across, that it was the conversation that we wanted to have. I'm seeing that we had a lot of questions. We tried to answer as panelists some of the questions. We tried to weave them in. So I hope people feel that they've also had their voices heard from within the audience. But again, just really a big shout out to Andres, to Anna, to Ben, to Hugo, to Jürgen, to Steve for actually being ready to join us today, and looking forward to seeing everybody next Thursday.